And we're back. Joining me today is Dr. Tony Miliano. I cannot talk today. I'm tongue-tied. From the Audiology and Hearing Center. And we're going to field some questions that have been sent to us.
Super.
You ready?
I'm ready. Let's go.
All right. Okay. All right. And our first caller wants to know, I've started experiencing ringing in my ears, decreased hearing, and dizziness. What could be causing this?
Well, the fact that you have all three of those symptoms combined is a little, actually three red flags. You know, when we're doing some case histories, you often see a red flag. The fact that you have hearing loss, tinnitus, and dizziness are three red flags. So that certainly is something that needs to be evaluated thoroughly by a doctor of audiology to determine the exact cause and etiology, because it could be anything from a simple ear infection all the way to, you know, more serious conditions related to the ear, possibly involving even some imaging or referrals to an ear, nose, and throat physician. So that's certainly something you need to follow up on.
Okay. All right. And our next caller wants to know, are there different types of hearing aids for different types of hearing loss?
That's a great question, because there are a lot of different types of hearing aids. Most of the time, the same type of hearing aid can be fit with a sensory neural hearing loss versus a conductive hearing loss. So the conductive hearing loss is most of the time a hearing loss that involves hearing loss within the bones of the eardrum inside the middle ear, as to where a sensory neural hearing loss is involving the nerve fibers within the inner ear. So many times we can fit those with the same type of hearing aid. However, there are different options, bone anchored hearing aids and things like that. So again, that's something that certainly needs to be discussed with a professional so you know what all of your options are.
Okay, so what is the difference between being treated by an audiologist versus like just a hearing specialist maybe at a big box store?
Oh, that's another great question. And most of the time, you know, your biggest difference is going to be in the education and experience. So as a doctor of audiology, you know, we have the education and experience with the anatomy, physiology, acoustics, and all that sort of thing to make sure that we not only accurately diagnose your hearing loss, but we also know the different treatment options and the specific etiology. Hearing instrument specialist doesn't have that education and training. They are licensed by the state. They do go through some on-the-job training, but most of the time their training is involved with just taking a test of the hearing to determine the degree of hearing loss and if you're a candidate for wearing a hearing aid or not.
Okay. And is there a certain age maybe that we should come and get a baseline hearing test?
Well, that's another good question, because actually there's regulations that require a newborn to have a hearing screening before they're discharged from the nursery. So the baseline ultimately starts as a newborn, but typically children will have hearing screenings when they get to be school age, so they pass those screenings. A lot of times that'll go on through the school years. As an adult, they typically don't have a need for the hearing screening until they get to be, you know, 55, 60 years old, unless they have some type of occupation where they're exposed to a lot of loud noise, and then obviously you need to have your hearing screened on an annual basis.
Perfect. Well, thank you for the information.
Sure.
Thank you for joining us. Yes. And if you would like to revisit this segment of Family Health Experts, log on to WPSDlocal6.com/Family Health Experts. Coming up next, Jeff Marcotte with Davis Drugs will be here, and we're going to look at some lift chairs. That's up next after this break on WPSD Local 6 Midday.
This is Family Health Experts, tips from local health professionals to help keep you and your family healthier, safer, and happier.
Hello, I'm Jeff with Davis Drugs. Have you noticed an elderly family member or friend struggle to get out of their recliner or chair? Today on Family Health Experts, we're going to talk about lift chairs. It might be just what they need to remain safe and independent in their own home. I'll see you real soon right here, WPSC Local 6 on Family Health Experts.
Get more information from our Family Health Experts, including the latest health news, by clicking on the Family Health Experts icon at WPSDlocal6.com.